Ever wondered if hidden dangers lurk in your daily routine, quietly posing deadly risks after 70? As we age, our bodies grow more vulnerable to health threats that don't always flash clear warning signs. Many assume sudden death is just a tragic, unbelievable twist of fate. But the truth is, specific triggers sharply raise the odds of life-threatening emergencies. Worse, most go unnoticed until it's too late. In this video, we'll unveil 5 sudden death triggers that can catch you off guard past 70. Not random health worries, but silent killers, striking when you least expect. From undecking heart issues to seemingly harmless habits, each can wreak havoc if ignored. The good news? Once you know them, you can act to shield yourself and slash your risk. Stay with me to the end. Grasping these 5 triggers could mean the difference between thriving in your golden years or facing an avoidable crisis. You'll leave knowing what to watch for and, crucially, how to protect yourself. Let's dive in. One of the sneakiest threats after 70 isn't a dramatic heart attack or stroke. It's something far quieter, a minor infection that silently spirals into a deadly condition called sepsis. Sepsis is the body's extreme reaction to infection, sparking widespread inflammation that can trigger organ failure, shock, and sudden death. Its danger lies in its subtle start. Dr. Henry, a spry 79-year-old who rarely saw doctors, proud of his resilience. One day he noticed more frequent urination with a slight burning sensation. Thinking it was just aging, he drank extra water, expecting it to pass. Days later, he felt exhausted, slightly confused, and oddly chilled despite warm weather. By the time his family urged him to the hospital, the infection had spread to his bloodstream. Within hours, his condition plummeted, and despite doctors' efforts, his organs began shutting down. Many don't realize that common infections, like UNT's pneumonia, or even a small skin wound, can rapidly escalate to sepsis in older adults. Aging weakens the immune system, making it tougher to fight infections. A simple UTI or respiratory bug can turn into a full-body emergency if bacteria enter the blood. Once sepsis kicks in, every hour without treatment hikes death risk. Early signs are tricky, mimicking everyday woes. Fatigue, left untreated. Sepsis can crash blood pressure, shutting down vital organs like kidneys, liver, or heart. Some cases progress so fast, hospital care comes too late. What can you do? Treat every infection seriously, no matter how small. Fever, chills, sudden confusion, or unusual weakness. Don't ignore them. If a minor infection doesn't improve with home care, seek medical help fast. For sepsis symptoms, rapid breathing, extreme comment. 1. Haven't subscribed? Hit that button and ring the bell for more life course insights. A sudden drop in blood pressure when standing might seem minor, but past 70 it can be deadly. Known as postural hypotension, this condition sparks dizziness, lightheadedness, or even fainting. For younger folks, a brief dizzy spell is just a nuisance. But for seniors, it's a top cause of dangerous falls, tumbles that can lead to fatal head injuries or hip fractures. The alarming part? Most don't see it as a serious issue until they've already fallen. Picture Clara, a lively 76-year-old who loved her morning coffee at the local diner. One afternoon, she stood up quickly from her chair and felt the room spin. Reaching to steady herself, she lost balance and hit the floor, fracturing her hip. Expecting a straightforward recovery, she faced complications, battling infections during weeks in the hospital. What began as a simple dizzy spell turned into a life-threatening ordeal. Falls are a major health risk for seniors, not just for immediate injuries but for triggering a downward spiral. Months of immobility weaken the body, raise blood clot risks, and invite infections. Many who suffer serious falls never regain full independence, and complications can be devastating. Why does postural hypotension hit harder with age? Our bodies slow at adjusting blood pressure when shifting from sitting or lying. The heart may pump less efficiently, and dehydration, medications, or underlying conditions worsen it. Some seniors feel fine seated but woozy standing, often without warning. A fall can unleash a cascade of hard-to-recover health issues. Ever felt dizzy standing up? Don't brush it off. Simple habits, standing slowly, staying hydrated, checking meds linked to low blood pressure, can lower your risk. Awareness is key. Spotting early signs and taking precautions can prevent a life-altering fall. If fall prevention resonates, comment 2. Go ahead and subscribe to us. Haven't subscribed? Hit that button and ring the bell for more life-improving. One of the deadliest risks after 70 is a heart attack. You don't even know you're having. Unlike the dramatic movie scenes where someone clutches their chest and collapses, silent heart attacks slip in quietly, often mistaken for indigestion, fatigue, or a mild flu. Their subtle symptoms mean many never seek help, leaving heart damage undetected until it's too late. Picture Walter, a spry 72. A few months back, he felt unusually tired, slightly short of breath, and had a nagging ache in his upper back. Blaming poor sleep, he shrugged it off. Unbeknownst to Walter, he'd suffered a silent heart attack. No crushing chest pain, so he assumed it was nothing serious. Weeks later, his heart, now significantly weakened, put him at high risk for sudden cardiac arrest. Silent heart attacks happen when blood flow to the heart is blocked, but symptoms don't scream emergency. Instead of sharp pain, you might feel discomfort in your jaw, neck, or upper stomach, or experience dizziness, unusual fatigue, or nausea. Some chalk it up to heartburn, muscle strain, or anxiety. Yet even without intense pain, your heart's starving for oxygen and damage builds. The real peril, a second more severe attack, a heart weakened by a slimmer survival odds. Many only learn of their heart attack during a routine checkup, or, tragically, after collapsing. Awareness is critical. Unexplained fatigue, shortness of breath, or odd upper-come discomfort, don't dismiss it. A quick electrocardiogram, occasionally called a blood test, can reveal silent damage. Prevention is everything. Subtle warning signs, even if they feel minor, can be the difference between life and death. If this hits home, comment 3 below to share your thoughts. Haven't subscribed? Hit that button and ring the bell for more vital health insights. Many assume blood clots only strike after surgery or long hospital stays. But the truth is far scarier. They can form silently in your legs, often without a whisper of warning. When these clots break free, they can travel to the lungs, triggering a sudden, fatal pulmonary embolism. This is why deep vein thrombosis, DVD, earns its chilling nickname, the silent killer. It builds slowly but strikes ruthlessly. Picture Clara, a 74-year-old who loved climbing on her porch for hours. Far from inactive, she ran errands, took short walks, and tended her garden. One day, after an afternoon lounging in her recliner watching TV, she noticed slight swelling in her calf. It wasn't painful, just a bit puffy. Thinking she'd just sat too long, she ignored it. Days later, shortness of breath hit, which she dismissed as a cold. Unbeknownst to Clara, a blood clot caused the swelling, and when she collapsed one evening, it had reached her lungs. She never saw it coming. DVT's terror lies in its stealth. It can strike even those who don't feel sedentary. Slow leg circulation, letting clots form. Symptoms are easy to miss. Mild swelling, slight tenderness, or a faint calf cramp. Feel far from urgent. But if a clot dislodges and hits the lungs, it can block oxygen in seconds, causing collapse or instant death. Seniors face higher risks as circulation naturally slows with age. Worsened by conditions like diabetes, heart disease, or high blood pressure. Certain medications, like those for blood pressure or cholesterol, can affect clotting and dehydration, common in older adults. Pickens blood, upping clot odds. These factors turn a small issue into a lethal threat. Prevention? Keep moving. If you sit for long stretches, stand and stretch hourly. Flex your feet, move your legs, and drink plenty of water to keep blood flowing. Compression socks help, and if you spot persistent swelling, redness, or warmth in your leg, don't wait to see a doctor immediately. Catching a clot early can mean the difference between routine care and a life-or-death emergency. If DVT awareness strikes a chord, comment 4 below to share your thoughts. Haven't subscribed? Hit that button and ring the bell for more vital health tips. One of the most overlooked dangers after 70 isn't a disease or accident. It's something happening in homes every day. Medication mismanagement. Taking the wrong dose, skipping a pill, or mixing incompatible drugs can spark life-threatening reactions. From sudden heart events and strokes to fatal internal bleeding. The scariest part? Many seniors don't realize they're at risk until a mistake turns catastrophic. Imagine Agnes, a diligent 80-year-old who'd taken blood pressure meds for years. Always careful with her morning pills, one evening she grabbed an over-complex pain reliever for back pain without a second thought. The next day she felt dizzy and weak, assuming she just needed breakfast. By evening she collapsed. Unbeknownst to her, the painkiller clashed dangerously with her blood thinner, causing undetected internal bleeding that proved too late to stop. As we age, our bodies process drugs differently. Liver and kidneys slow, leaving medications lingering longer, sometimes building to toxic levels. Drugs harmless in youth can hit harder. And mixing the wrong ones, even over comfort meds or herbal supplements, can lead to severe, even deadly outcomes. Blood thinners, heart meds, and pain relievers are common culprits. But missing a dose of harsh or diabetes medication can also send your body into shock. Prescription overload adds complexity. Many seniors juggle multiple drugs for some need an empty stomach, others food, some don't mix, and others demand precise timing. A simple slip, like doubling a dose after forgetting if you took it, can trigger a blood pressure crash, dangerous low blood sugar, or a lethal heart rhythm. Protect yourself by keeping an updated list of all medications, including supplements, and ensuring every doctor knows what you're taking to avoid risky interactions. Use a pill organizer or set reminders to prevent missed or extra doses before starting any new drug, prescription, or over the conclave. Check with your doctor or pharmacist for safety with your current regimen. Your health is too precious to leave to chance. One small medication error can be devastating. Stay informed and organized. It's a lifesaver. If medication safety hits home, comment 5 or roll it back low for more. Critical health insights. Hydration might seem like a minor issue, but after 70, it can silently spiral into a deadly threat. Aging dulls thirst signals, and many seniors don't drink enough water, leading to thickened blood, strained organs, and increased risk of heart strain or kidney failure. Symptoms like dry mouth, confusion, or weakness are often mistaken for fatigue or aging, delaying critical action. Picture Mal Moth, a 75-year-old warm day. She felt dizzy and sluggish, assuming she was just tired. Ignoring her dry mouth, she collapsed from severe dehydration, her heart unable to cope. Studies show dehydration in seniors doubles risks of life-threatening complications. Stay hydrated, sip water regularly, even without thirst, and watch for subtle signs. If dehydration awareness resonates, comment 6 below to share your story. Now that we've uncovered 6 sudden death triggers after 70, silent heart attacks, postural hypotension, deep vein thrombosis, sepsis, medication mismanagement, and dehydration. Pause to reflect on which might touch you or a loved one. Most folks don't realize how fragile health can become with age, with the deadliest threats often slipping by unnoticed. Until it's too late, ever. Felt dizzy standing up or ignored mild leg swelling. Blaming a long sit? Small tweaks, standing slowly, staying hydrated, moving regularly, or double-quicking meds can be lifesavers. This video isn't meant to scare, but to empower you with knowledge. Spotting subtle signs like silent heart attack warnings, early sepsis symptoms, or dehydration cues can add vibrant years to your life. Proactive health isn't just dodging danger, it's ensuring you keep savoring life, cherishing time with loved ones, and doing what brings joy. Which trigger hit home? How will you act on it? Share your story in the comments below. Your insights could inspire others. Your voice matters, so don't hold back. If this video sparked new ways to protect your health, give it a like, hit subscribe, and ring the bell for more life-quitting tips to thrive past 70. Thanks for joining me, and I'll see you in the next one.